We are saying happy birthday today to a woman who was not afraid to take on some tough health topics, even if it led to her losing her job.
Joycelyn Elders was born on this day in 1933. She's a veteran and served as President Bill Clinton's first Senate-confirmed Surgeon General. She was the first black person and the second woman to serve in the role.
Her confirmation process was a brutal one. Some challenged her credentials. Some didn't seem to realize she was a licensed physician. Once she was finally confirmed in September of 1993, her first public appearance was coincidentally in Portland, Maine.
Dr. Elders was speaking to an organization of public health officials, and as Rob Caldwell shows us, she made it clear she intended to shake things up.
Dr. Joycelyn Elders says she doesn't mind being a lightning rod as long as there are supporters behind her providing the thunder. What she wants to do is nothing less than change the way Americans think about their health.
I want you to know I'm spending more time talking to the Department of Education than I'm talking to the Department of Health, because I don't think that we can reform health care in a society that's not educated.
It may take a while for the message to sink in. The two issues that swirled around Elders during her confirmation hearings were abortion, which she favors, and condoms, which she thinks should be distributed in schools, even if needed in elementary schools.
I feel that if children are sexually active and if they would desire a condom, I would rather that they use a condom than for them to take an undesired risk.
Her audience of healthcare professionals likes the message.
Well, I'm tremendously excited. I feel really optimistic for the first time in a long time about the direction of public health at the federal level.
And the heart of her preaching isn't about abortions or condoms or sex. It's about education, about preventing health problems.
Our insurance system has to change. Our healthcare system has got to change. We've got to begin to focus on how can we keep people healthy, rather than spending all of our efforts taking care of them when they're sick.
Healthcare reform, AIDS, rural medicine, teenage violence, all of them are issues the Surgeon General wants to get to, but she's focused on her top priority.
The thing that I would like to accomplish before I leave this job is I would like for every child born in America to be a planned, wanted child. And I feel the best way to address that is we've got to educate them. I would like comprehensive health education to be at every school in America.
That was Rob Caldwell with the story from 1993. Now, Dr. Elders was already a familiar figure to President Clinton. She had led public health efforts in his home state of Arkansas while he was governor.
But her public health perspective did not match evenly with Clinton's, and he repeatedly felt he had to push back on her comments, like her stance on legalizing drugs.
And I do feel that we would markedly reduce our crime rate if drugs were legalized.
Now, to be clear, that was a piece of a soundbite from a larger speech where she urged the legislation of drugs to be studied. Still, the comments got pushback from all across the country.
Substance abuse care providers we spoke with at the time were also hesitant about the idea of legalization of drugs. One counselor who was herself in recovery told us she worried it would make drugs more available to addicts. But public health officials here also told us there's no one way to treat addiction.
Treatment works, and when people get help instead of punishment, then they can change. And we see miracles happen all the time when people get help.
And the silver bullet doesn't exist to solve the problem. Just like there's a whole multitude of reasons why people abuse drugs, there have got to be a whole multitude of ways to resolve that problem.
The final straw for the Clinton administration was over comments she made about sex education.
She was speaking at a UN conference about AIDS and was asked whether masturbation might be put forward as an alternative to intercourse. She said the following, quote, "I think that is something that is a part of human sexuality, and it's a part of something that perhaps should be taught. But we've not even taught our children the very basics, and I feel that we have tried ignorance for a very long time, and it's time we try education," end quote.
The public pushback to that suggestion was the final straw for Clinton. Dr. Elders was forced to resign after just over a year on the job, but she kept her public health work. She returned to Maine in 1995 to speak about the public health response to the AIDS virus. Dr. Joycelyn Elders was the shortest stint as a Senate-confirmed Surgeon General. We'll be right back.